Hi, everybody. My name is Jess Forster, and I have worked in the pediatric diabetes clinic at Markham Stouffville Hospital for the last 14 years. In addition to providing a professional role, I have enjoyed meeting and working with people diagnosed with type 1. I also have a few people in my family who I know and love are also diagnosed with type 1. So I'm so happy to be here. DHF has always been a huge resource for us in clinic, and I'm happy to be a part of today's discussion.
Amanda, welcome.
Hi, everyone. Thanks, Barbara. My name's Amanda. I'm a 2010 scholarship recipient, and I've done a number of the Diabetes Hope Foundation events over the years, and it personally really helped me in my own transitions throughout multiple stages of life. I am a registered nurse, and I've done a variety of things with that involve diabetes. I've worked as the nursing coordinator with Camp Huronda, and then I did a couple of years on the floor as a nurse, but diabetes found me again, and now I'm a clinical diabetes specialist with Tandem Diabetes.
Thank you, ladies, for sharing your wonderful information. I think, Clara, are we going on to the next question?
Yes, we are. So to start off the panel, here we have some common themes and topics that come up maybe when we're talking with our clinicians. And so the first question for our clinicians today is about virtual appointments. So when COVID hit, many aspects of our lives went virtual. Almost every aspect of our lives went virtual, and this includes many of our doctor's appointments. As clinicians, are you guys finding that many youth are not keeping their virtual appointments? And are you doing anything different in this virtual world to ensure that youth stay on track with their diabetes management? So we can start with Jess.
So as the social worker on the team, we have moved obviously to about 90% virtual appointments. When COVID hit initially last March, we went completely virtual, which was a change of pace, I think, for everyone. And we have been slowly trying to figure out this virtual landscape. We do see patients. 25% of our patients do come into the hospital and have to go through obvious screening measures, but we are trying to provide more online support. And what do I mean by that? So our patients see their endocrinologist for essentially 20 minutes over Zoom or over OTN. And that is not a lot of time to deal with everything that you have on the screen here. Self-care, burnout, physical activity. And so we are trying to encourage our families to not only upload their information, especially if they are technology-based, so whether that's on a pump, on a meter that is connected to some sort of virtual program. We are trying to prepare for the visit beforehand, see them, and then we deal the allied health. So myself, dietitians, nurses, we try to reach out for support as needed. So my number of virtual appointments that I do after school, my 3:15, 4:15, 5:15 appointments are fully booked. And then specifically for those transitioning youth, we are also providing webinars. We know that we are not providing the same information as we would in clinic, and so we are targeting the people who are born in a specific year who are transitioning in September. We are actively targeting them and providing webinars to give this kind of information. It's not just a one-time thing. We've started in February. We're having more virtual webinars in July and August, really to remind families of the issues that you face. But it is a challenge. It was a challenge in person. It's a challenge virtually, but we want to do the best for our families and for our patients.
Thanks, Jess. Those webinars, I'm sure, are really, really valued and really useful. Brittany, how about you?
Yeah, so with my last position as a research coordinator there, we didn't have to deal with people going through transition very often. And in my position now, I've heard a lot of positive feedback with virtual visits in, the uploading of information and people getting that ahead of time, like the healthcare providers getting that ahead of time, so that when they do meet with the transitioning population, the visits are like quite productive. So that's a positive that I've heard. But otherwise, I don't have a lot of firsthand experience as a nurse working with those in transition.
Amanda, how about you?
Yeah, so right now, one of my big roles in my job is doing training on the tandem pump and, helping people who may be struggling. And what's been a positive out of the virtual, I know that, pros and cons to everything. Of course, I miss being face-to-face with everyone, but it has opened up a lot of opportunities that I think could, reflect into how we can assist youth who are transitioning. So for example, if I have somebody reach out and they'd like to try a new infusion set, I never would have thought before that I'll jump on a video call and walk them through step by step how to do it. And so I think if you're looking at transitioning to a school, across the country, and there's a lot of hesitation to that, and you have to go to your first diabetes appointment alone, I think that opportunity to be able to open up the fact that, you could have your guardian video call into that very first diabetes appointment. And so I think that what we've seen in the virtual sense is that people have responded quite well to it. I think better than we all thought that it would go. And so we've seen a lot of positives come out from the virtual component. And I think the big one that I've personally found is just more access to resources, where sometimes we'd have to wait to train an individual until they're back on their reading week from university or in the summertime, and all this rush to do these things when they're back home, where now we have that opportunity to kind of help them with that transition by just jumping onto a video call and semi-face-to-face helping them.
I think a silver lining of everything moving virtual is definitely the increased accessibility. It's definitely a positive, and it's something that I hope doesn't go away when when the pandemic is over and done with. Rav, I think you have the next question for our lovely clinicians.
Yeah, for sure. Speaking of being in the virtual world, it's great that we're accessible and we can reach each other. But kind of a downside of, the virtual world is that it can be kind of isolating, and kind of how Amanda touched on, we do miss that like face-to-face human personal interaction. And I know for me, when it comes to mental health, personally, my diabetes clinic hasn't really helped me if I needed support, which is okay, because I have been a personal advocate for pushing to find resources that work for me. And currently, most transition and mental health services are hospital and institution-based to provide support for youth with diabetes. How are you supporting our youth to address their fears and anxieties by the pandemic and its impacts on diabetes distress? So let's start with Brittany.
Yeah, so I can speak to, I'm working on my Master of Nursing right now, and my focus is on transition of care. So I can speak to what I've read in the research. Again, I don't have quite that personal experience yet. I'm sure that'll come, like Amanda said, in the month, but I'm still getting into my new job. So it's a huge component of successful transition is having peer support, and like someone that you can chat to about these things if your healthcare team is not as accessible to you, or maybe people aren't comfortable having those discussions in a virtual environment or a phone call. That's something that's really intimate, and they might not feel comfortable with that. So having that peer support is huge, and really tends to positive outcomes in transition. Just to complain about stuff or ask questions, try to find someone, in their university or college that maybe also has type 1. All these things will really help with mental health for sure.
Yeah, that peer support piece is really important. And I know our alumni will talk about our mentorship program and their experiences with that, but that is available, and we'll touch upon that in a little bit. So Amanda, you next.
Yeah, so I think one of the big things, with diabetes burnout and that added layer now with everyone going through, the struggles of what COVID has brought, it's kind of finding creative ways to deal with these struggles that, before we could reach out, hang out with some friends, the community that way. But I think that the virtual world has, again, opened up a lot of opportunities for individuals to join communities. And so having this big online, accessibility across the board to kind of let people know that they're not isolated, because I think that's the biggest struggle, is that when you're feeling stressed about sometimes, just knowing that somebody else feels a similar way sometimes relieves a big part of that burden, because you're not thinking that why am I feeling like this, why am I tired of having diabetes. So if you just kind of throw that thought out into the world, I'm tired of having diabetes, I'm feeling burnt out, and when you hear everyone else kind of echoing that sentiment and then through that offering their tips and tricks. So I think that, it's finding these creative ways to connect with people and build that support, because we are going through, everyone's got their own story with it, but all very similar positions to it.
Yeah, for sure. Especially with us even doing these webinars and like our pre-webinar meetings, it's so nice to just like talk about it. And there's even a lot of great like Instagram accounts that I've like followed recently about who have diabetes, and I'm like, this is great. And it's been such a good way to kind of avoid feeling so isolated. So Jess, what about you?
So I loved what Amanda said is, finding your community, finding your supports, finding your resources, and being able to vent, sort of like what Brittany said. And the important thing to remember in this unique time period is that we are not alone. We are not alone in the struggles that we have. There's this extra layer of challenge when you put a chronic condition on top of this. And what we've done specifically at the hospital is not only offer webinars around mental health, but also remind people of the resources that are out there. So part of my job is to connect people to community and give them a certain number of options that they can access. And certainly the DHF peer-to-peer support program is one that we often mention. We also talk about Good to Talk, or Kids Help Phone, which people can text or transition. There are What's Up walk-in clinics, as well as whether you are in a school accessing guidance support, or post-secondary and accessing campus mental health services. The important thing that we like to talk about and to remind people is that do not wait. If you are starting to feel that downward, like I can't get out of this rut, this feeling, this stress, this burnout, it is incredibly courageous and actually very, very strong to say, hey, this is not working for me. And I need somebody to rely on. And so building in those support systems are just so incredibly important. So please, please, please do not wait. In terms of my clinic, I am, always available to chat to people, and I would be happy to, help unload those thoughts, feelings, fears, stress, burden, sadness, the grief of what it's like to live through this global pandemic. So if you don't take anything away from what I've just said, please just remember this. Please do not wait, and please ask for help.
For sure, and it does take time to kind of get comfortable asking for help, but one small step forward, and things can change for the better. So thank you, Jess, for all. I would love to have you in my clinic. You're awesome.
That's very powerful, ladies, and especially when we talk about mental health, it is so important that everyone knows where to go and who to speak to, because we are all living in very unusual times where our human nature is not used to this. We're used to touching and feeling and hugging and seeing and being part of. So for sure, your information, Jess, and all of those on the panel were very impactful, and there will be some resources that we will be including at the end of this webinar, so look for those particular resources. Before we get into the COVID question, I want everyone, our audience, to look at all of these areas that we have logged from speaking to several alumni. And these were the issues that were actually very prevalent in their first and second year university. So if any of you out there want more discussion on it, please give us a chat and we will further discuss it, because we're just moving into the next question, in that what does COVID and post-secondary school look like to our panelists as they're transitioning? We'll start with Jess.
So COVID, I mean, if anybody has a crystal ball and can read the future, that would be great. I don't know what COVID and post-secondary school looks like, but what I would suggest in terms of, you know, now that you have this opportunity, now that we're in a series of, you know, partial lockdowns, you know, we have time to practice our transition skills, right? I think as clinics, we are trying to get better at communicating what transition looks like. And as we have, certainly in my own experience as the social worker on the team, I think the understanding of what it looks like, what transition looks like in terms of COVID, I think we're getting a better sense that it's probably going to be virtual, it's probably going to be online. But what we always recommend, you know, whether you're going in person or via classroom, is trying, you know, these different transition activities. So do you know the names of your medications? Do you know where you can get your insulin? You know, sometimes the insulin fairy just doesn't arrive and put the insulin in the fridge. You know, you have to go to the pharmacy and actually order it. You know, from now until next September, you know, having your young adult practice, talking to the pharmacist, even ordering the supplies, knowing where they're going to get the money from. You know, is that going to be a post-secondary, you know, is your tuition going to cover it, or is your family plan going to cover this? There are so many things that that you can practice from now till then.
Amanda, your thoughts?
So I think, again, you know, with COVID, we've had to adapt. And one of the nice things with diabetes, and one of my roles with the Diabetes Hope Foundation is with the scholarship committee and reading all those. And you know, the biggest theme is that, you know, we can adapt with diabetes. We've become very good at that. And so kind of applying those skills to the fact that with COVID, you know, those expectations that we had for what transition will look like and these new experiences going off to that next step after high school are going to be very different. And so, you know, Jess spoke to that about, you know, you're allowed to feel that grief for those changes and kind of that loss of this isn't what it was supposed to be like. And so being able to, again, just reiterate, reaching out, finding that community, hearing that other people are feeling that way, and just recognizing that, you know, not everything has to have changed. You can still work towards building that independence in your transition, even if that means that you haven't left, you know, your parents' house. Maybe you're still in that same location, but you can still be working through different things that transition could mean to you and what you want from your independence kind of moving forward. And so it's, you know, you don't need to cut ties and transition and become independent on day one by any means, but just looking at, you know, what are some of the goals that I can now change? What would I like to achieve in this kind of new transition that's here? So I think really it's the openness to adapting and maybe just reworking some of those kind of visions that you had for yourself transitioning to that next step.
That's great advice, Amanda. You know, and basically what you're saying is taking baby steps, not really changing what you're doing, but just taking baby steps to move to the next level. Brittany, what are your thoughts or advice for parents and kids?
Yeah, I'm kind of echoing what Jess and Amanda have already said, but I guess a positive of the fact that a lot of education will be virtual is we now will have a safe environment to gain independence without being fully like away from their safe space. So, you know, like as Jess mentioned, like getting prescriptions on their own, increasing this sort of independence, but they're still home. So if they did forget, you know, mom and dad are there to help out. But just starting to, get those sorts of thoughts going in their heads is really important. So, and hopefully next year when we can actually go back in person to things, they are already like really comfortable with those basic things, because you're going to need to know how to do those things as an adult. That's just the reality. So if you're able to do that in the safe environment of your home slowly, then I think that's really impactful and could be a really big positive actually out of all this. And then also like the peer support and getting involved with things at your school, outside of diabetes even, because that gives you a chance to learn about new people. Maybe they can learn about you and learn about diabetes, which is always great to educate others about type 1. And I think that's just a really great experience too, that could be had.
Thank you, Brittany. That's wonderful information. And ladies, thank you for your very valuable insights and for sharing it and being so articulate in your points. We really appreciate it. Now we'd like to welcome our lovely parent panel, Vicki Firth and Michelle Stanford. So let's start with Vicki. Just give us a brief introduction.
All right. My name is Vicki, and I have a daughter who's 19. She was diagnosed at 8 with type 1 diabetes, and she is currently in her first year of university.
Thank you. Michelle.
Good morning. My name is Michelle Stanford. I have 3 children, but one of them is a T1 diabetic. Her name is Natasha. She's in first year at Queen's, and she was diagnosed when she was 14.
Terrific. Thank you.
Yeah, honestly, like my mom was the one who knew that something was wrong with me when I got diagnosed. So shout out to all the moms who just know and have that gut feeling and support their kids. So I really do appreciate all the moms out there. So I think we all know that it's common for there to be some kind of challenge when we're raising adolescents. Under most circumstances, both the parent and the child work towards increased child autonomy and independence. Now, when a child grows up, they develop relationships and receive support from others, and that kind of leads the parent to adapt because now their role is changing in their child's life. And now for parents who have youth with diabetes, these normal developmental issues have an extra layer of complexity to them. Critical short and long-term health and safety implications are directly associated with the child's lifestyle and diabetes management. Now, parents may feel confused and unsure about how much responsibility to hold on to during their child's transition. However, studies have shown that support from parents has been linked with better adherence in youth with chronic illnesses. So how did you assist your child with their transition to ensure that they were ready to manage, diabetes management on their own? Let's start with you, Michelle.
I think the key, and I know that Vicki and I have very similar experiences, or at least approaches to our children. We started with Natasha, first of all, very subtly, right? It wasn't like we all of a sudden said, okay, like you're responsible now. We started with really 3 areas for her to begin to show herself, and then us, that she could manage things on her own. And some of it's already been talked to, right? So first of all, ownership and responsibility of what you need, right? So starting to, how does she access the medication supply? Who does she call? Does she have the contact in her phone, et cetera, et cetera? Scheduling her own appointments, right? It used to be me that scheduled her and told her when to go. Now she schedules me and sends me an invite. And then the other piece she had already done really well at because she was in high school, but it was her having to learn again how to have those self-advocacy conversations, right? So teaching her roommates and or her new teammates, right, about the signs and symptoms, low blood sugar, emergency plan, where the glucagon is, and then sort of a renewed focus on her own readings, right? So that self-advocacy says I need to be able to tell people what I want, and then I also be able to really need to know what I need to know in terms of the data. And then, lastly is about preparedness, which I'm sure Vicki will talk about when it comes to, we actually made her get we didn't make her do much, but we did make her get a new visible medical alert bracelet because she was going into a whole new environment where people didn't know her. as opposed to, you know, we had the backpack and the glucagon patch and things like that. So it was almost like we had to restart everything we did in grade 9. But this time, Mom wasn't in charge. She was in charge, and I was like her assistant coach.
Yeah, you have to be like her cheerleader, and I'm sure Natasha is adapting really well. Especially that self-advocacy piece is so important. It's such a uncomfortable thing to do at first, but you just get the hang of it. And so I really do appreciate all that you did for Natasha. How about you, Vicki?
Similar to what Michelle did with her daughter, we started preparing our daughter early on in order to manage her own diabetes, slowly giving her ownership of the different tasks that need to be done. We knew that she was more than likely going to go away for school. So I think it was as early as grade 11, we started shifting some of the responsibilities over to her so that she'd be prepared and that we'd be confident that she would be okay on her own. I think that's a really you don't only want your child to be confident and comfortable, but it's also helpful for yourself to be. As parents, we are often, you know, always going to be a little bit on edge, but it's an added comfort to know that, or have confidence in your child. We did things like she would have to order her own supplies. She had an issue with her pump one time, and I said, okay, fine, I'll sit here with you, but you're calling tech support and figuring it out. And yeah, just basically getting her 100% prepared to deal with these things on her own. Now, one thing I found, though, that we learned this year is, as parents, we still need to be prepared as well. Our daughter had an issue where she'd been home for the Christmas break. She'd gone back to school. She'd put her insulin in her mini fridge in her dorm room. She'd put some cream in there for her morning coffee. She woke up the next morning and the cream was frozen solid. So it was iffy as to whether the insulin was okay or not. And she could easily go to a pharmacy in the community where she's living for school. She's only an hour away from home. So we hadn't actually moved any of her prescriptions or anything over. But we thought, wow, what if this happens at midnight? What if there's an issue with supplies or something? We should still have a stock at home because we had actually sent everything off with her. So that was sort of a learning curve for us because, yes, again, there are resources where she's living, but if it's 1 a.m., I would rather, because she's only an hour away, hop in the car and deliver something rather than have her Ubering around her city trying to find available resource. But that's something that, particularly if your child's going further away, you might want to look into all the eventualities, all the issues that could arise, and sort of make a plan in advance just in case that happens so nobody's panicking in the middle of the night.
Yeah, that's such an important thing to highlight, is especially if you're moving far away. Because at first I moved 5 hours away and I was like, I got this, I'm prepared. Turns out I wasn't. So I had to kind of on the spot just be like, okay, where do I go? Look at the transition guide. I'm like, okay, cool. So it's really, honestly, I support that, you know, you have that backup for Alyssa, because it kind of keeps you comfortable and at peace of mind. So I do really respect that.
From your perspective of parents, what's the greatest challenge for your child during this current transition? I just want to add that both of your daughters were guinea pigs this year. One of them went to university, went to the dorm, the other one came back or is living at home. So they had to sort of navigate together collectively with you and your family. They had to figure out by themselves because this has never been done before. So this is an interesting question because they've already walked the walk.
Yeah, and it's a relevant issue right now, you know, in my perspective, given that it's highly unlikely that this year's graduating class, the class of 2021, will be able to go into full-on like residence, right? So our position, Natasha was accepted into residence at Queen's, and then when they separated, when they said only 50% of people can go into residence, we said to her, you're not going. You're not going because we don't know about this illness, and we do know that type 1 diabetics are at higher risk. So given that university is, you know, kind of crazy to begin with, we thought that would be too much risk for her, right? So the risk of getting sick with COVID, while also obviously, you know, managing, you know, a potential complication. So we said to her, you know, don't go. And then it turns out she applied anyway, and she got in, and then we refused to let her go to restrict, like, to short-term residence. But then what we said to her was, why don't you get like an off-campus accommodation with 3 or 4 other people that is safer for you, it's safer for them. And so that's what they did. She plays field hockey for Queens, so some of the first year students got their own place. And the challenge, I think, with, you know, certainly Vicki's daughter has had diabetes since 8, Natasha's had it since 14. They've had a massive amount of transition to deal with, and their, you know, hour to hour, day to day is complicated. But this is the first time that their disease puts them at risk for something else. So I noticed that a lot of the same why me frustrations that came up when she was first diagnosed came back up again, until Natasha got really adamant about people doing the right thing to stay safe with COVID, right? So high risk behavior, teenagers, you don't feel like you're at that great risk. And she, you know, ended up finally kind of coming around, realizing that she needed to follow the social distancing, masking, hand washing, really, and make sure she still does it. She won't let other people who are behaving high risk come into their house. So the advocacy skills came into play way more during this period.
Vicki, would you like to share your advice?
The way COVID affected us initially was when Alice was in grade 12, she had planned a couple trips independently, which would have been the first time she'd been away from home for an extended period of time, aside from going to Camp Huronda, where she would have had to manage her diabetes 100% on her own. Because of COVID, those trips got canceled, so going to university was really the first time she was going to be on her own for an extended period of time. She did opt to go into residence. She didn't want to miss that experience, and I think was looking forward to getting out there with a bit of independence and such. The university was really good, however, and has continued to be, just with their protocols around COVID. She's in a traditional dorm room, which ordinarily she'd be sharing a bathroom with the person in the room next door, but they've made them all completely single. So she has this really nice large bathroom to herself and her own room. They're not allowed to have any gatherings in common rooms or anything like that. They do eat at a dining hall. The tables are socially distanced and they wear masks, and she's really good and very much an advocate for continuing to keep COVID protocols in place. So it really hasn't been a worry in that regard. If anything, she worries a little bit because as happens, there are people who opt to disregard the protocols and party on campus. And that does make her nervous because she just wants to get what she can out of the university experience this year and be safe doing it. What made me feel really good as a parent is that I had mentioned a bit earlier on in the academic year if she would be interested in trying res again next year if things were back to, you know, some sort of normalcy and getting the typical first year university residence experience. And she said, you know what? She said, I don't think my experience would be that much different because she did manage to make some friends through her classes virtually and through others in the residence, and had a group that she would go have breakfast with in the morning and such. So that made me feel really good that despite everything going on, she still found it a valuable experience this year.
I just have a question. So she actually experienced kids in her environment who were going against proper protocol?
There were a couple outbreaks on campus, smaller ones, which were reported, obviously, to those who were living on campus. And just, I guess, word of mouth or through social media or such, she would hear that there were people attending parties. Not necessarily on campus. I think most of they were all off campus, but it was students who were involved.
So it's a bit concerning now with this new variant, that younger kids are now getting COVID quicker, you know, and it's getting a little more severe for them. Does that concern any of you?
I'm hopeful that they'll soon be in line to get their first vaccination. So I think Michelle and I are both in the same region, and we seem to be moving pretty well along with the vaccination. So I'm hoping that their cohort will come up soon to be able to receive it, which will make me feel a little bit better to know that at least she's covered that way.
Yeah, and Vicki, you're way more optimistic than I am. One of the things that I've been really frustrated by is the lack of definition around this next phase, right? So I track the vaccine data like kind of a data crazy person, but the government hasn't even articulated what the kind of high risk group and their caregivers are. So that, we are, probably 6-8 weeks away from getting to the next level, which is 65 to 75-year-olds plus our children, right? So the way that it's defined right now, it says people with chronic illnesses, and their caregivers that put them at greater risk, but they're not saying who that is. So I'm quite alarmed, actually, that, we've had a 70%, I just ran the data, 70% increase in the percentage of patients in the hospital who are in the ICU. So hospitalization numbers have dropped from like a high of 1,700 on January 12th to, 685, 985 now, but there are 37% of the people, 1 in 3 is in the ICU. So these are young people. Old people don't go into the ICU. So I'm stirring the pot a bit with our government, and we have citizenship in another country, and I'm thinking about taking my daughter, there, because it's just anyway. Don't even get me started. But
okay. I think Diabetes Canada worked a deal with the government that diabetes, youth with diabetes or anyone with diabetes is considered chronic. So perhaps you should just go online for Diabetes Canada and check out what they're doing and what agreement they made with the government.
Yeah, I've done all that. Anyway, it doesn't, they can make promises, but the government has not articulated that type 1 diabetics are in line for the vaccines at a certain point in time. So that's alarming.
Do you have a final message for any other parents that might be watching, or any, your best piece of advice for parents of type 1 diabetic youth? We can start with Vicki.
I think just to reiterate what we've sort of said here, prepare your children to succeed, give them the confidence to be able to manage their diabetes on their own, but also be the support person and the resource that they always have in their back pocket when they need somebody.
Yeah, I agree with that. I'm in my mid-20s now, and I'm fully independent with my diabetes, but sometimes I still call my mom and say, hey, can you do this for me? And she still does it for me. So it's good to have that. Michelle, one last message or piece of advice for parents.
Yeah, I just say be their coach, right? You're raising an adult, and you're not going to send them out on the field unless you've kind of prepared them and put them in the right equipment. So just never shame them and never blame them.
I think that's awesome advice. Thank you, Vicki and Michelle, for sharing your wonderful insights. And here's to all the parents who help their children spread their wings. It's not easy, but I know we all appreciate their support. If you have any comments, please feel free to email us at info@diabeteshopefoundation.com. It's also up on the slide right now. We hope this webinar was helpful to those watching. We hope that you took some positive takeaways from it. So thank you for watching. Have a great day and stay safe.
Bye, everyone.
Thank you all. Stay safe.